Did you know that by administering vaccines, we can stop the spread of preventable diseases in many cattle and pigs and save many of these livestock? Vaccines are used globally. One of the more common vaccines, the flu shot, is used in humans and is recommended during the fall and winter months to prevent the spread of the influenza virus. Vaccines such as the flu shot are also used in livestock such as cattle and pigs to prevent the spread of disease. Vaccines are vital to the health and well-being of cattle and pigs and can be administered in two safe but effective ways. The CDC defines a vaccine as a product that stimulates a person's immune system by building immunity to a specific disease, which will then protect that individual from that disease. This can be said the same for livestock. A vaccine introduces an animal to that disease, in turn building up antibodies and immunity, protecting them from that disease in the future. The government of Western Australia's Department of Agriculture and Food says that vaccines prevent a wide range of diseases that can cause reduced production, fertility problems, or even death in cattle and pigs. Vaccines are administered in two ways, intramuscular or subcutaneous. There are other methods, but these are the two main ones when it comes to livestock. Intramuscular is performed by pushing the needle directly into the muscle and injecting the vaccine. By using intramuscular, we are able to introduce the vaccine quicker into the animal, and it gets into the bloodstream quicker and lets it take effect. However, when doing this, we ruin the muscle structure and ruin the meat merit of that particular livestock animal. Michael Baker, in an interview with Farming Magazine, states that when using intramuscular, there will be a 3-inch circumference spot in the injection site in that particular muscle, which will be tougher than the rest of the meat. Subcutaneous, on the other hand, is injected directly underneath the skin into fatty tissue. When doing it on animals, it is injected in the neck, and you will use your fingers and grab a fatty piece of skin, as you can see that I am doing here on myself. Subcutaneous does not ruin the meat merit of that animal, but it does take longer to get into the bloodstream and to take effect. Next, I will demonstrate both of the methods on oranges. This can be, by using oranges, I will be able to show the two methods and to be able to show how they spread once they are injected. First, I will show intramuscular. You will safely remove the cap to your needle, and when you have your animal, you will inject straight into the muscle, inject the vaccine, and safely remove the needle. I will set this here, and you will want to replace the cap so you do not poke anyone or yourself. When using an actual vaccine, you would have entered that into the animal, and you would not want to contaminate yourself or expose yourself. Now, when doing subcutaneous, we will do the same thing. We will inject just underneath the skin. Another problem that occurs with subcutaneous is you can have abscesses or bubbles underneath the skin. As you can see with this orange, I have created just a little bit of a bubble. Next, I will cut these oranges in half to show the effects of the vaccine in their spread. As you can see, with the intramuscular, the vaccine went directly into the center. And with the subcutaneous, it entered into the skin and then slowly seeped in. With an animal, this would take a lot longer, but as I used water and food dye, it seeped through the orange faster. In conclusion, vaccines are a great way to stop the spread of preventable diseases in both humans and animals. Vaccines are vital to the health and well-being of cattle and pigs and can be administered safely in 2 effective ways.